Today we're going over different types of pharmacology practice questions. Are you ready? Okay, let's get started. First question says, what is the minimal apical pulse the nurse should obtain prior to administering digoxin, or also known as lanoxin, to a hospitalized 5-year-old? Is it 1, 60, 2, 70, 3, 100, or 4, 120? So for this question, let's take a look at the key words. It says that you're giving the patient digoxin, right? So in order to pick the best answer, you gotta first identify the keywords, which would include the apical pulse, the fact that they're administering digoxin, and that they're 5 years old. So digoxin is a medication that we usually give to patients that have poor heart contractility. So this was often given with CHF patients. So for this one, most people would choose 160 because they're considering the fact that that's the standard rate, but that's the standard rate for adults. Because you have to remember that the question says a 5-year-old. So want to make sure that you take note of all the keywords. So the answer is going to be 2. A 5-year-old needs to have an apical pulse rate at least 70 before digoxin can be administered. So when it comes to the heart rate for infants and babies, theirs runs a lot higher than adults. So it's important when it comes to your nursing exams that you study the differences in the normal vital signs, the normal parameters for infants and babies, especially if you struggle with pediatrics when it comes to your exam. This medication, digoxin, slows the heart rate, and the normal heart rate of a 5-year-old is between 70 and 100 beats per minute. All right. If you got that answer correct, go ahead and comment below and let me know if you got it correct. The next question says, a nurse is caring for a patient who routinely takes warfarin, also known as Coumadin. Which of the following food choices should the nurse advise the patient to limit in their diet? Is it going to be 1, ice cream, 2, broccoli, 3, orange juice, or 4, chicken? So if you know, for when it comes to warfarin or Coumadin, this is a what? This is a medication that helps patients when it comes to developing blood clots. So we typically give it to your patients who have atrial fibrillation in order to prevent them from developing a stroke or a clot. So what you have to be aware of is what is the antidote when it comes to Coumadin, right? So meaning that what would cause the Coumadin to stop working? That's what this question is essentially looking for. Is it wants to see if you recognize the food choices that would contraindicate with Coumadin. So we know that vitamin K is that medication. Sorry, vitamin K is the antidote, which is typically seen in green leafy vegetables. So therefore, the best answer is going to be 2, broccoli, right? So broccoli is a green leafy vegetable and is a good source of vitamin K. The patient should avoid excess consumption of vitamin K because in excess, it has a negative response to the effects of warfarin. Ice cream, orange juice, and chicken do not affect coagulation. If you got that correct, go to comment below and let me know that you got that correct. And if you're finding this video helpful, make sure that you are staying tuned and definitely share this video right now on your page, whether it's on your social media pages or via text, or anybody that you feel would benefit from this information. Go ahead and share this video right now. All right, next question. Question says, you are providing teaching to your patient related to a new prescription for methotrexate for severe psoriasis? Which of the following pieces of information should you be sure to include? 1. Drink a glass of wine daily. 2. Monitor for evidence of infection. 3. Monitor kidney function, test regularly. Or 4. Expect increased bruising. All right, so for this question, what are our key words, right? Keywords here are the drug, methotrexate, fact they have severe psoriasis, and it says which of the following piece of information should you be sure to include. So when it comes to these type of questions, you have to know, it wants to pretty much see if you understand what's the most significant nursing precaution with giving that specific drug. So it will require for you to spend enough time studying, reviewing, or already knowing a wide variety of different medications that are commonly administered. All right, they're commonly administered, they're commonly given, because these are common problems you'll see on your nursing exams or in real life. So for this one, the best answer is going to be 2, right? So 2, which was monitor for evidence of infection. So you should be sure to instruct the patient to monitor themselves for infection, such as by watching for fever and or sore throat. So methotrexate, it can cause blood discolorations. So this is now where you have to be aware of the side effects of this drug. So one thing I always tell people is, I tell students, is to memorize at least 2 side effects for the medication. So methotrexate can cause blood dyscrasia. It can also result in a decrease in white blood cells, which will lead to a decrease in them being able to fight off infections. So patients should not drink alcohol because it could cause liver damage when consumed with this medication. Liver function tests should be frequently monitored rather than kidney function tests. Patients should not expect increased bruising. Rather, they should report any increase in bruising because methotrexate can cause blood transfusions such as thrombocytopenia. All right, so comment below if you got this correct. Go ahead and comment below and let me know if you got that question correct. If you didn't get this question correct or you didn't get any of the questions correct, then it may be a sign that you need to brush up on more pharmacology medications. So either learning more medications and making sure you really understand what they do, the rationale, what their side effect is, and what are some important nursing precautions. If you felt like you recognized the drug, but you still got the questions incorrect, then you probably need to work on your interpretation or critical thinking skills when it comes to the question. So I would recommend that you join our next 12-week NCLEX review class if this sounds like you. So if you want to really learn how to step things up and better understand the content, better understand comprehension, critical thinking, especially if you've been out of school for at least 6 months or longer, or you struggled out your program, then this is the review class that you want to attend in order to position you so that way you can truly succeed. And we've had some amazing testimonials of students who literally have passed their exam even before the class was over and went on to secure new nursing, RN, and LPN jobs where they were making 3 times their salary. So if you want to learn more information on your cell phone, go ahead and text the word review. All right, text the word review to 470 671 3491, and then we'll send you a text message with more information. Or you can scan the QR code on the screen right now, or you can also check the link below for more information in the description. We hope that you found this very helpful and informative, and we'll see you the next time. Make sure that you go ahead and share this video as well with somebody that would find this beneficial. See you soon.